101. The trigeminal nerve controls the corneal reflex. True or false? Answer: true. Rationale: the trigeminal nerve, cranial nerve V, provides sensory input for the corneal reflex, while the facial nerve mediates the motor response, critical for neurological assessments. 102. The peripheral nervous system includes the spinal cord. True or false? Answer: false. Rationale: the peripheral nervous system comprises nerves outside the central nervous system, which includes the brain and spinal cord, a key distinction for neurological anatomy. 103. The primary somatosensory cortex is located in the frontal lobe. True or false? Answer: false. Rationale: the primary somatosensory cortex is in the parietal lobe, processing touch and proprioception, while the frontal lobe handles motor and executive functions, vital for neurological localization. 104. The vagus nerve regulates respiratory rate. True or false? Answer: true. Rationale: the vagus nerve, cranial nerve X, modulates respiratory rate via parasympathetic input to the lungs, a critical autonomic function in neurological regulation. 105. Astrocytes produce myelin in the central nervous system. True or false? Answer: false. Rationale: astrocytes support neuronal function, while oligodendrocytes produce myelin in the central nervous system, a key distinction for understanding neurological repair. 106. The cerebellum adjusts muscle tone during movement. True or false? Answer: true. Rationale: the cerebellum fine-tunes muscle tone and coordination during movement, essential for assessing ataxia in neurological examinations. 107. Serotonin is primarily involved in motor control. True or false? Answer: false. Rationale: serotonin regulates mood, sleep, and appetite, while dopamine and acetylcholine are more involved in motor control, critical for neurological pharmacology. 108. The optic nerve is responsible for pupil constriction. True or false? Answer: false. Rationale: the optic nerve, cranial nerve 2, transmits visual signals, while pupil constriction is controlled by the oculomotor nerve, important for neurological reflex testing. 109. The sympathetic nervous system increases salivary gland secretion. True or false? Answer: false. Rationale: the sympathetic nervous system reduces salivary secretion, while the parasympathetic system increases it, a key autonomic response in neurological function. 110. The conus medullaris is located at the T12 vertebra. True or false? Answer: false. Rationale: the conus medullaris, the spinal cord's end, is typically at the L1, L2 vertebral level, a critical landmark for neurological procedures like lumbar punctures. 111. The hypothalamus produces antidiuretic hormone. True or false? Answer: false. Rationale: the hypothalamus regulates antidiuretic hormone release from the posterior pituitary but does not produce it, a key concept for neurological endocrine function. 112. A stroke in the right hemisphere can cause left-sided neglect. True or false? Answer: true. Rationale: a right hemisphere stroke can impair spatial awareness, causing left-sided neglect, a critical clinical finding in neurological assessments. 113. The accessory nerve is responsible for tongue movement. True or false? Answer: false. Rationale: the accessory nerve, cranial nerve 11, controls neck and shoulder movements, while the hypoglossal nerve governs tongue movement, key for cranial nerve exams. 114. The blood-brain barrier is formed by loose endothelial junctions. True or false? Answer: false. Rationale: the blood-brain barrier is formed by tight endothelial junctions, restricting substance entry to protect the brain, a vital concept in neurological pharmacology. 115. The corticospinal tract originates in the cerebellum. True or false? Answer: false. Rationale: the corticospinal tract originates in the motor cortex, controlling voluntary movements, while the cerebellum coordinates movement, important for neurological motor pathways. 116. The amygdala regulates body temperature. True or false? Answer: false. Rationale: the amygdala modulates emotions, while the hypothalamus regulates body temperature, a key distinction for understanding neurological autonomic functions. 117. The glossopharyngeal nerve controls taste on the anterior tongue. True or false? Answer: false. Rationale: the glossopharyngeal nerve, cranial nerve 9, controls taste on the posterior third of the tongue, while the facial nerve handles the anterior 2/3, critical for neurological exams. 118. The corpus callosum is responsible for motor coordination. True or false? Answer: false. Rationale: the corpus callosum connects cerebral hemispheres for communication, while the cerebellum handles motor coordination, important for neurological function localization. 119. The dorsal root ganglia transmit motor signals to muscles. True or false? Answer: false. Rationale: dorsal root ganglia contains sensory neuron cell bodies, while motor signals originate from the ventral horn, a key concept for neurological reflex arcs. 120. The reticular formation is located in the cerebral cortex. True or false? Answer: false. Rationale: the reticular formation is in the brainstem, regulating alertness and autonomic functions, not in the cortex, critical for neurological consciousness assessments. 121. The facial nerve is responsible for the sense of smell. True or false? Answer: false. Rationale: the facial nerve, cranial nerve 7, controls facial expression and taste, while the olfactory nerve governs smell, important for neurological sensory testing. 122. The basal ganglia are involved in memory formation. True or false? Answer: false. Rationale: the basal ganglia regulate motor control, while the hippocampus is primarily involved in memory formation, key for neurological cognitive assessments. 123. The parasympathetic nervous system constricts pupils. True or false? Answer: true. Rationale: the parasympathetic nervous system, via the oculomotor nerve, triggers pupil constriction, miosis, a critical response in neurological pupil assessments. 124. The middle cerebral artery supplies the medial frontal lobe. True or false? Answer: false. Rationale: the middle cerebral artery supplies the lateral cortex, including temporal and parietal lobes, while the anterior cerebral artery supplies the medial frontal lobe, key for stroke localization. 125. The pons regulates heart rate and breathing. True or false? Answer: true. Rationale: the pons, with the medulla oblongata, contains centers that modulate heart rate and breathing, critical for assessing neurological vital sign regulation. 126. The hippocampus is located in the brainstem. True or false? Answer: false. Rationale: the hippocampus, part of the limbic system, is in the temporal lobe, not the brainstem, and is critical for memory, a key structure in neurological disorders. 127. The spinothalamic tract transmits proprioceptive signals. True or false? Answer: false. Rationale: the spinothalamic tract carries pain and temperature signals, while the dorsal column-medial lemniscus pathway transmits proprioception, important for neurological sensory exams. 128. The trochlear nerve controls downward eye movement. True or false? Answer: true. Rationale: the trochlear nerve, cranial nerve 4, innervates the superior oblique muscle, enabling downward and inward eye movement, critical for neurological cranial nerve testing. 129. The sympathetic nervous system promotes peristalsis. True or false? Answer: false. Rationale: the sympathetic nervous system inhibits peristalsis, while the parasympathetic system promotes it, a key autonomic function in neurological digestive regulation. 130. The internal capsule is located in the cerebellum. True or false? Answer: false. Rationale: the internal capsule, containing motor and sensory tracts, is in the cerebrum, not the cerebellum, a critical structure for neurological stroke assessments. 131. The vagus nerve is responsible for shoulder movement. True or false? Answer: false. Rationale: the vagus nerve, cranial nerve X, regulates visceral functions, while the accessory nerve controls shoulder movement, important for neurological cranial nerve exams. 132. The primary visual cortex is located in the temporal lobe. True or false? Answer: false. Rationale: the primary visual cortex is in the occipital lobe, processing visual input, while the temporal lobe handles auditory and memory functions, key for neurological localization. 133. The cauda equina is located above the conus medullaris. True or false? Answer: false. Rationale: the cauda equina consists of nerve roots below the conus medullaris, a critical anatomical feature for assessing lower limb neurological function. 134. The substantia nigra is involved in reward processing. True or false? Answer: true. Rationale: the substantia nigra, part of the basal ganglia, produces dopamine involved in reward and motor control, a key structure in neurological disorders like Parkinson's. 135. The optic chiasm is located in the retina. True or false? Answer: false. Rationale: the optic chiasm, where nasal retinal fibers cross, is located near the pituitary gland, not in the retina, critical for assessing neurological visual field defects. 136. The medulla oblongata regulates voluntary eye movements. True or false? Answer: false. Rationale: the medulla oblongata controls involuntary functions like heart rate, while voluntary eye movements are governed by cranial nerves 3, 4, and 6, key for neurological exams. 137. The dorsal horn of the spinal cord processes motor signals. True or false? Answer: false. Rationale: the dorsal horn processes sensory input, while the ventral horn handles motor output, a critical distinction for understanding neurological reflex pathways. 138. The limbic system regulates heart rate and blood pressure. True or false? Answer: false. Rationale: the limbic system modulates emotions and memory, while the brainstem regulates heart rate and blood pressure, important for neurological autonomic function. 139. The abducens nerve controls pupil constriction. True or false? Answer: false. Rationale: the abducens nerve, cranial nerve 6, controls lateral eye movement, while pupil constriction is mediated by the oculomotor nerve, critical for neurological assessments. 140. The prefrontal cortex is responsible for language comprehension. True or false? Answer: false. Rationale: the prefrontal cortex governs executive functions, while language comprehension is handled by Wernicke's area in the temporal lobe, key for neurological language testing. 141. The choroid plexus is located in the cerebral cortex. True or false? Answer: false. Rationale: the choroid plexus, which produces cerebrospinal fluid, is in the brain's ventricles, not the cortex, a critical structure for neurological fluid dynamics. 142. The sympathetic nervous system increases bladder contraction. True or false? Answer: false. Rationale: the sympathetic nervous system relaxes the bladder to inhibit urination, while the parasympathetic system promotes contraction, key for neurological bladder control. 143. The corticobulbar tract controls limb movements. True or false? Answer: false. Rationale: the corticobulbar tract controls cranial nerve functions like facial movements, while the corticospinal tract governs limb movements, critical for neurological motor pathways. 144. The hypothalamus regulates sleep-wake cycles. True or false? Answer: true. Rationale: the hypothalamus, via the suprachiasmatic nucleus, regulates sleep-wake cycles through circadian rhythms, a key function in neurological health assessments. 145. The facial nerve controls the stapedius muscle in the ear. True or false? Answer: true. Rationale: the facial nerve, cranial nerve 7, innervates the stapedius muscle, which dampens sound vibrations, critical for assessing neurological auditory function. 146. The posterior cerebral artery supplies the frontal lobe. True or false? Answer: false. Rationale: the posterior cerebral artery supplies the occipital lobe and parts of the temporal lobe, while the frontal lobe is supplied by anterior and middle cerebral arteries, key for stroke localization. 147. The ventral root of a spinal nerve contains sensory fibers. True or false? Answer: false. Rationale: the ventral root contains motor fibers, while the dorsal root contains sensory fibers, a critical distinction for understanding neurological nerve pathways. 148. The Broca's area is involved in motor planning for speech. True or false? Answer: true. Rationale: Broca's area in the frontal lobe coordinates motor planning for speech production, critical for assessing neurological language deficits in conditions like aphasia. 149. The sympathetic nervous system promotes sweating. True or false? Answer: true. Rationale: the sympathetic nervous system activates sweat glands via cholinergic fibers, aiding thermoregulation, a key autonomic response in neurological function. 150. The thalamus processes olfactory information. True or false? Answer: false. Rationale: the thalamus relays most sensory information, but olfaction bypasses it, going directly to the olfactory cortex, a critical distinction for neurological sensory pathways.